to welcome you today to our World Breastfeeding Week and our August National Breastfeeding Month, and overall for women's health and maternal health. So thank you all for being here. I want to acknowledge for a moment our dignitary, Congressman Larson. Thank you so much for being here. And I would be remiss if I did not recognize our Jeffrey Flax. And I want to take a moment to thank Gary Blumberg, who's really our HHC Manager of Video Services, but you would never know it because he's also our saxophonist. So thank you. Hartford Hospital has a long-standing, and Hartford Healthcare, a long-standing commitment to breastfeeding and its importance to health and growth of our families. We have thousands of children in our community and beyond that are proof of that every day. I wanted to take a moment to really acknowledge the unbelievable team that we have here, the amazing women's health team, and the work that they have done over decades to recognize and have had an impact on our city of Hartford, our Hartford region, and the entire state of Connecticut, and really have touched lives, and we are so grateful for the difference they have made. And now it is my pleasure to introduce Laura Bailey, who is our Chief Nurse and our Vice President for Patient Care Services. Laura.
Good morning, everybody. It's an absolute pleasure to be here today. Thank you so much for joining us. As we gather here today to celebrate World Breastfeeding Week, we're reminded of the profound impact that breastfeeding has, not just on individual health, but on the well-being of entire communities. Breastfeeding is more than a personal choice, it's a public health priority. It lays the foundation for lifelong health, cognitive development, and economic strength. It reduces healthcare costs, it improves outcomes, and it empowers families. And when we support mothers through skilled counseling, supportive environments, and access to accurate information, we are investing in the future of our communities. At Hartford Healthcare, we take this commitment seriously. Our commitment to supporting breastfeeding mothers, our commitment to maternal health. Hartford Hospital was the first hospital in Connecticut to earn the prestigious baby-friendly designation, a recognition that reflects our dedication to evidence-based practices that promote breastfeeding. Our staff are trained to help mothers initiate breastfeeding within the first hour of birth, support skin-to-skin contact, and provide continuous education throughout the hospital stay. Across our system, we have created baby-friendly environments that empower mothers in their feeding choices and provide the support they need to succeed. I also want to draw your attention to the orange bracelets. On June 16th, Hartford Healthcare was a leader in rolling out these bracelets across our system, and because of the work here in our system, this has now had an impact in our state. So mothers are encouraged to wear these bracelets for 8 weeks after they deliver a baby. We partnered with our emergency room and our community partners, our EMS partners, to make sure that they all know that if they see a mom with this bracelet on, it means that they recently gave birth. And we have a lot of special needs for our patients that in the postpartum period after they deliver that we need to make the community aware of. And this bracelet is going to help decrease maternal mortality and morbidity in our state. So, and I'd like to recognize Pam Bell for the work. This demonstrates that our support does not stop at discharge. We offer weekly support groups, home visits for families, and access to certified lactation consultants and specialists 7 days a week. We know that the continuation of care is what helps mothers navigate the challenge of early parenthood, and we are here and will continue to be here for them every step of the way. With that, I would like to introduce, it is my pleasure to introduce Mary Marshall Prim, the manager of the lactation program at Hartford Hospital.
Well, hello everyone. As you all all have heard a few times, we are very proud to celebrate World Breastfeeding Week and recognize National Breastfeeding Awareness Month. This year's theme is to prioritize breastfeeding and create sustainability, which calls upon all of us to continue building environments that value, protect, and support breastfeeding as a key pillar of public health. Hartford Hospital has done just that for the past 25 years. We're proud to be one of only 8 hospitals in the United States to have maintained baby-friendly designation consecutively since 2000. This remarkable achievement is a testament to our long-standing commitment to promoting, supporting, and protecting breastfeeding, while also respecting and honoring families' informed decisions to use formula. We know that skilled breastfeeding support is essential, not only for improving maternal and infant health, but for building stronger and healthier communities. That is why all our staff within Women's Health Services at Hartford Hospital are trained to support breastfeeding from the prenatal period through the first year and beyond. Today we are here to honor our breastfeeding champions, staff members who have been nominated by their peers for demonstrating exceptional commitment, compassion, and expertise in breastfeeding and lactation support. These champions personalize their care, empower families to overcome challenges with confidence, and serve as trusted resources to their colleagues by sharing best practices and offer ongoing support. Beyond our hospital walls, Hartford Hospital has partnered with Paving the Way, a mentorship program designed to support women of color in becoming board-certified lactation consultants, expanding our lactation care within our community. We also collaborate with community doulas who provide labor support and immediate postpartum breastfeeding guidance, a critical time that can shape a family's feeding journey. And we care for our own team too. Hartford Hospital supports our lactating colleagues by providing safe, private, and comfortable spaces for milk expression during the workday, because sustaining breastfeeding means supporting our workforce as well. Now I'm honored to invite our breastfeeding champions to come forward and receive their gifts. Please hold your applause until the final champion has been recognized. Devin Root from Women's Ambulatory Health Services. Teresa Snyder, also from Women's Health Ambulatory Health Services. Dawn Paulus from Maternal Fetal Medicine. Sandra Rivera from Postpartum Unit. Sasanka Peterson from Postpartum Unit. Samora Travado from North 8. Thank you all. Thank you.
Mary, you want to come down and join?
Oh, and Erica is from Postpartum Unit, Erica Austin. Thank you for being here.
All right. Excuse me, sir.
valued employee who has experienced Hartford Hospital both as a patient and a caregiver. She is a colleague who continues to provide breast milk for her child thanks to the support of her workplace. Janelle S. Diaz.
Yes, Viviana, we hear you. Good morning, everyone. I'm excited to share about my breastfeeding journey as a working mom who's worked here for all 3 of my babies, weeks away from completing our journey with our 3rd. I cannot stress enough the importance of a supportive work community to make that happen. Breastfeeding is a rewarding experience, but does not go without its hard work and commitment. Upon returning to work, there's always a new level of stress and challenges trying to figure out how to balance that once you come back. Whether it's finding time to pump, having a clean and private space to go to, you have the pressure of pumping, remembering all your parts and pieces, trying to eat and chart simultaneously, all while being sleep deprived, and then you're worried about if your team is going to watch your patients when you're gone. Looking back, I've realized how lucky I am. I've truly been supported, and I have been successful in breastfeeding all 3 of the kids for their first year. It's not easy balancing work and motherhood, especially in healthcare, but at this hospital, it's doable. With a culture that respects and values what working moms are managing every day, I have to say also the advocacy and support that lights a fire under Mary for anyone who extends to anyone who knocks on her door, has helped in creating and promoting this culture of supporting breastfeeding staff, here at HH, any employee, and really anywhere. You don't even have to be an employee, you can call her, she's gonna help you. Thanks to the supportive system provided, we employees have access to dedicated private and clean rooms, safe lactation amenities, there's freezer bags, we have a microwave, there's a sink to wash your hands. If you've done it, you know that it makes a world of difference. A small but impactful room for us moms. Flexible break times allowed for us to go and pump. Understanding colleagues that have made literally all the difference because we couldn't do it without them. Thank you, Mary, for helping HH reach this positive and supportive culture for our fellow colleagues and employees. Thank you to Center 8 ICU for supporting me through this journey and attending to my patients while I'm off the floor. Although I know it's a nuisance multiple times a day, I've lived the reward and I'm forever grateful for it, as we can see with my 3 babies over there.
Janelle, thank you so much for sharing your story with us. Really First of all, I want to start just by recognizing everyone in our Women's Health Division, our Maternal Health Fetal Medicine Program, our breastfeeding team. We have the greatest Women's Health Division. We do the most amazing things for people every day. Thank you, thank you, thank you. So please recognize this. So I have the opportunity today to introduce as good a friend as Hartford Hospital and Hartford Healthcare could ever have. And Congressman John Larson is known to all of us because John Larson, as a congressman, every Friday, every Saturday, every Sunday, whenever he's in town, which is all the time, he's visiting his constituents. I can tell you, he doesn't ask for any type of special accommodation, but he comes here to visit the people in his constituents constantly. So we always admire, we say, my gosh, does he have a lot of friends? Because he's always here. But who he's really a great friend to is Hartford Healthcare and Hartford Hospital, because Congressman Larson always delivers. There's been a number of times of real significant moments where we have needed the help to navigate things at the federal level, to bring money back to Connecticut, to bring resources back to Connecticut so we can have these types of programs and services. And when we've been in our moments of greatest need, where we've had the most difficulty, the first call we make is to Congressman John Larson. He answers the phone every single time, and he always figures out a way to help us, and he does it in the most selfless way. Never from in front, never seeking or any attention or recognition, but always doing it for the right reason, because he cares so deeply about this community. So today, when I invited him, I said, could you please come, because we're honoring some very, very special people. The answer is the same thing always, which is yes, I'll figure it out. So thank you for being here today. Thank you for being such a key part of this organization, Congressman John Larson.
Wow, how do you follow that? The important thing, I think, today is that here at Hartford Healthcare, I feel like I'm part of a family. Just listening to Janelle's story and seeing the recipients of this distinguished award, and to be called a quest for quality hospital. What did Jeff call it? The Stanley Cup of hospital awards? It all starts with principle-centered, people-oriented leadership and care. And that was expressed throughout every remark this morning. And it's so true when you look at the professionalism and the care and the quality of care that you provide. There's no doubt that this is the leading hospital in the state and a leading hospital in the United States of America. And I'm proud always to be affiliated with it. And in as much as this is Breastfeeding Awareness Month, etc., having legislation before Congress and knowing the vital importance of what it means and the professionals who are going to carry this out. And in a climate today, frankly, where when you look at the so-called big, beautiful bill and realize that it decimates Medicare and Medicaid, and it's going to impact over 186,000 people. And while the president claims he's not touching Medicare or Medicaid, he's just shifting responsibility down to the states and local municipalities and hospitals, what are federal responsibilities, and then asking people to pay for those. And that will result in either cuts, layoffs, or diminished ability to meet the needs and demands of the people we're all sworn to serve. I assure you, we're in this fight. Our whole delegation is dedicated to making sure that we repeal this act, that we stand up for all of you and the outstanding care and commitment and the compassion that you bring daily to your job deserves and demands the support of every member of Congress and the President of the United States. We're going to take that fight to Washington. We're going to continue to fight every single day so that hospitals like Hartford all across the nation and here in the state of Connecticut will be able to continue to deliver the quality care that you provide. I thank Jeff so much and all of you, and Patty Verno, my I call her Patty, everybody else calls her Patricia, but, you know, for all that you do. He talks about, whenever he calls me, I assure you, I call Hartford Hospital a lot more than he calls me. And you always deliver. And it's a great sense of pride to be part of a family and know the professionalism, the care and compassion that you bring to your job every single day. God bless you. God bless America.
At large, and thank you for being here today. In addition, Janellis, what a beautiful family and an amazing story, and you are an unbelievable representative of what a beautiful family can be in this organization, in our community. And hearing it from you as one of our own is extremely meaningful. So thank you, truly, for being here. I just want to take a minute. On August 25th, Hartford Healthcare will be hosting a breastfeeding event at the state capitol to showcase our commitment again to maternal health and child health across for the community, for the organization, in support of all of the individuals we serve. And I just to take a moment and thank all of you for being here today and making a difference this morning, and the contributions of all of you. Appreciate it. Have a great day.